Hi, this is Dr. Homer Lim, and you're listening to your Holistic Health Podcast. Good afternoon, everyone. Welcome again to our weekly talk here at Kesis Holistic Health. So this afternoon, we'll be talking about Parkinson's. No, Parkinson's is a condition, no, more often also among mga elderly, no. So what is Parkinson's disease? Parkinson's disease actually is what we call a neurodegenerative disease. Neurodegenerative means it affects your nerves, specifically your brain cells in the what we call the substantia nigra. So this is part of the brain wherein it controls yung movement. So, and this part of the brain, the substantia nigra, also produces what we call dopamine. Dopamine. So when that part of the brain is affected, or is degenerated, so the person starts having symptoms. Earliest symptoms usually is what they call yung tremors, or panginginig. So they would complain sometimes of movement, wherein when they're at rest, meaning at rest wala silang ginagawa and there's some form of trembling. The most common tawag nila is pill rolling. Pill rolling, makita mo their hands, they would do like this, like that, or like that. So at rest, but when they would move, nawawala. So iba yung tremors ng Parkinson's versus what we call yung benign tremors. Benign tremors naman yun yung, di ba, matatanda madadalas pag gumagalaw, mabagal, So they would shake as they are moving, Eventually, if your Parkinson's becomes very severe, then during movement also mayroong panginginig, But in the beginning, usually yung tremors, usually is at rest, Which is again another difference between benign tremors, tawag natin, yun yung tremors ng mga matatanda compared to Parkinson's. Yung Parkinson's kasi, it will affect eventually all the muscles in the body as compared to yung benign tremors, usually yung mga motor muscles, Pero in Parkinson's, when it becomes severe, magkahirapan ka ng lumulon, huminga. So that's why yung Parkinson's is a very serious disease, especially if you are not able to treat it early. Why? Because if you don't treat it early, mas mabilis yung pag-deteriorate ng patient. So aside from yung tremors, tawag natin, mabagal yung galaw nila. So para silang robot when they are walking. In fact, a lot of them when they are walking, sa sahig, and then may kita silang lines, nalilito sila, hindi nila alam paano sila mag-i-step. So that's also one thing that is very common among Parkinson's patients, is yung movement nila parang robot, mabagal na, parang stop, So this is what we call the rigidity, Okay. So another sign of Parkinson's is very, very common also, yung their facial expression halos nawawala, especially if medyo matagal na yung Parkinson's, nag-deteriorate, nawawala na yung facial expression nila, so they can hardly smile or frown, kasi medyo naapektuhan na rin yung nerves sa muscles in the facial muscles, So and then eventually naglalaway din sila. So that's one thing that is a problem with patients with Parkinson's, naglalaway. Why? Because hindi sila makapag-swallow. So they have a hard time swallowing. Mabagal din yung muscles nila when they swallow. So eventually, a lot of patients with Parkinson's, they die really of pneumonia because nabubulunan sila, nabubulunan. If you remember, Pope John Paul II, he had Parkinson's. So when it was really very bad na, nahirapan na siyang kumain, so lumulo, So it really becomes a problem, So now discussing Parkinson's, so it's a disease of the brain cells, unable to produce what we call dopamine, So ano yung gamot niyan? The gamot doesn't really cure it, it just delays the progression, So you have a bit number of drugs available, But the main drug there is really what we call the L-DOPA, no? So L-DOPA, it helps give the patient the ability to move better, no? As compared to without L-DOPA, nanginginig talaga sila or sobra nilang bagal gumalaw, no? Now, on the natural side, no? I think what we need to address also that is very important for patients with Parkinson's is yung presence of what we call heavy metals, no? So there've been now a lot of research now wherein they took the brain, literally yung brain ng mga taong namatay from Parkinson's, and they checked for heavy metals, no? So they found out that those patients with high levels of either lead, aluminum, or mercury were those in sa may Parkinson's, they seem to have more of these heavy metals compared to people without Parkinson's. So that's one thing that I think we have to address also. So if you have family or friends diagnosed to have Parkinson's, so you have to look at the risk factors. So one of the risk factors really is yung presence of heavy metals. So in the textbooks, they won't really say yung pinaka-cause, but one association really is the presence of heavy metals. So the thing we do there is we have to make sure that we remove the exposure of heavy metals, usually mercury sa mga seafood, So, a lot of seafoods, especially malalaking isda, have high levels of mercury. So, we have to avoid that. Aluminum, yung mga cookwares natin, yung rice cooker, usually they're made of aluminum. So, these things you have to be aware of that they can cause a deposition in the brain, yung aluminum, So how do you prevent or how do you delay the progression of Parkinson's? So, we can do several things. We can do acupuncture. We can do what we call IV lasers, or there's also a new therapy. It's called photobiomodulation, which is using LED light, nilalagay sa ulo, infrared light, and then it stimulates the brain cells, So this is a very new therapy, very, non-invasive, easy to do. Patients can do it at home, every day. There's no really side effects or whatever. So aside from that, of course, we do a lot of drips. For drips, I would say, I think there's been a bit of research now on using glutathione. So it does not cure it, it just prevents delays the progression of the Parkinson's. We can also do what we call scalp acupuncture. So we've done a bit of scalp acupuncture. Really, when you do scalp acupuncture in these patients, yung tremors nila would eventually die down or almost gone within 3 to 4 sessions, unless there is really a very severe form of Parkinson's already, But in early stages, just doing scalp acupuncture once a week really helps in delaying the progression of their Parkinson's, Okay, so we have the exposure to heavy metals, we have the treatments, So a lot of patients with Parkinson's, they also have difficulty in, for some reasons, smell, They seem to lose also some sense of smell. So we really know that talagang naapektuhan yung nerve cells nila. So there's what we call degeneration of their nerve cells, Parkinson's is probably second most common neurodegenerative disorder, second to Alzheimer, Alzheimer or dementia is still the number one form of neurodegenerative disorder, Okay. Now I will read some questions from our listeners and answer them in this segment. What supplement would help prevent Parkinson's? Actually, there's no really supplement to show that it prevents Parkinson's. So, but I would suggest, if you're afraid of Parkinson's, if you have mga mga mercury amalgam, yung mga pasta that's black or silver in color, that you have to remove kasi that can cause accumulation of mercury, So that's very, very important. You have to I had one patient, she had so many pasta sa ngipin, and she was really bad, nanginginig yung buong katawan. She could not even get out of her chair. Umiihi na siya sa mismo sa chair niya. So I really felt bad for her. And then I told the daughter, your mom, she have to have all her mercury amalgams removed, And she would not believe it because she was a dentist. So to her, dental amalgams are practically safe, no? But eventually, I found out later that they did remove the mercury amalgam, no? And she got better. So, kumbaga, there's a connection between the amount of mercury in your oral cavity and the risk of developing not only Alzheimer's but all forms of neurodegenerative disorder, no? So, and in fact, no, if you might not know, no, since last year, no, it's now illegal, no? So it's not allowed to use mercury amalgam. So it's not allowed. Dentists are not allowed to use mercury-based amalgam kasi nga it's been banned here already in the Philippines, no? What laser acupuncture? Laser acupuncture is the same as needle. It's just that instead of using needles, you use a laser device, no? Usually, no, patients with Parkinson's would usually develop in the later years, usually past 60s. Now, there are people who develop Parkinson's at the very earlier age, no? So, but they are, more of an exception rather than the rule. So, usually, they start, in the 50s and then well into their 70s, no? And there are also people who are, boxers. You see Muhammad Ali, Freddie Roach, who usually also used to be a boxer, no? So they have Parkinson's. So these also can be a source or cause of Parkinson, yung traumatic head injury, no? Sila kasi very baga laging nauuntog yung ulo, no? So they usually develop Parkinson's at an earlier age, no? Okay? Thank you for listening to your Holistic Health Podcast. This is Dr. Homer Lim. Now, if you do have questions about your health or you would like to request topics for our next podcast, please do message us at our FB page or Instagram at Akesis Holistic Health, or you may visit our website at www.akesisholistic.com. Thank you again, and please do come back for our next episodes.